so today we'll be doing a head-to-toe assessment. And to start the head-to-toe assessment, I'll start by looking at the patient's face, head, and neck. And I'll also be palpating to see if there's any abnormalities, okay? And to see if there's any inflammation or swelling. And also palpating the neck for the thyroid gland, okay? And then I'll be looking at the eyes and the conjunctiva, and also the ears for any discharge, okay? And also the oral mucosa for their hydration levels. Also looking at the tongue and the teeth, okay? So moving on to the neurological assessment, I'll start by assessing their level of consciousness by asking them to state their name, date of birth, and if they can, the hospital they're currently in. Then I'll assess their pain. I'll ask if they're in any pain, and if they are, I'll ask the patient to rate the pain from 0, having no pain, to 10 being the worst pain. Next, I'll also be assessing their mood. I'll ask the patient how they're feeling, if they're feeling any anxiety at the moment. And then next, I'll check their eyes for pearla. So I'll be shining a light in both eyes, like so, making sure that the pupils constrict, okay? So next, moving on to the musculoskeletal assessment, I'll be checking the patient's grip strength on each side, asking the patient to squeeze my hand, and also pushing against my hand as I apply resistance, okay? And I'll also assess the patient's range of motion of their hand, making sure that they can supinate and also pronate. Next, I'll move on to the feet, making sure that the patient can dorsiflex and plantar flex, dorsiflex and plantar flex, and also comparing the strength and movement of both sides. So moving on to the cardiovascular assessment, I'll start at the apical pulse. So the apical pulse can be heard 5th intercostal space, mid-clavicular line. So I'll take my stethoscope here. So the patient should have a apical pulse rate at 60 to 100 beats per minute. So listen at the point. Okay. And listening for full 60 seconds and making sure that the pulse is regular. I'll also be listening to the other landmarks of the heart rate, listening for the S1 and S2 here at the atrial, pulmonary, Erb's point, tricuspid, and mitral valve. Alright. So next I'll be assessing the patient's peripheral pulses, assessing their radial pulse, okay, and then dorsalis pedis pulse, and also the posterior tibial, making sure I don't use my thumb. And I'll also be noting if the patient's pulses are either weak, normal, or bounding. Then I'll check the patient for any edema, also assessing their skin color, and also the capillary refills. So to check capillary refills, I'll be pressing against the nail bed of their fingers, and then counting how long it takes for the capillaries to refill. It should be within 3 seconds, which indicates good circulation. Okay, so moving on to the respiratory assessment, I'll ask the patient to sit up here, okay, slowly, and I'll be inspecting if the patient is using any accessory muscles for breathing. I noticed that she's not. And now I'll be listening for her breath sounds. Starting below the clavicle, I'll ask the patient to breathe. Okay. Okay. also listening to posterior. Alright, so I do hear clear breath sounds, making sure that she does not have any crackles. And as I was listening to the breath sounds, I was also assessing for her cough, her chest expansion, and also her respiratory effort. Okay, so patient could lie back down here. And then I will also assess their pulse ox, their O2 sat, and if they do have oxygen per MD order, I'll see if they do have a nasal cannula and also check the flow rate to see if it's either 3 liters or 4 liters. So moving on to the gastrointestinal assessment, I'll lift up the shirt here. So I'll be assessing the abdomen. First I'll be inspecting to see if there's any redness or any distension. Next I'll be auscultating the 4 quadrants. Okay. Listening for any bowel sounds. And if the patient does have an absent bowel sound, I will listen to a full 5 minutes to make sure if the bowel sounds are indeed absent. And then after auscultating, I'll be palpating 4 quadrants. Okay. And you auscultate before palpation because you do not want to manipulate any of the organs, and which can cause adventitious sounds. So after that, I'll ask the patient to describe their stool and also their nutrition, and also tell me what they ate in a 24-hour period, and also ask the patient if they're feeling any nausea or vomiting. Next, I'll be moving to the GI, the genitourinary assessment. So I'll also ask the patient to describe their urine, if it's clear, if it's yellow, if it's amber, and also see if they do have a Foley catheter, and also check the bag to see if the urine is draining properly through gravity, and also to see if the patient has any discharge or any incontinence. So moving on to the integumentary, the skin assessment, I'll be inspecting the whole body, checking for any lesions, for any rashes, any incisions, and also to see if there's any surgical drainage, to see if there's any IV sites. If they do have IVs, you want to check to see if there's any redness or infiltration or phlebitis. I'll also be looking for pressure ulcers. So I'll be checking bony prominences like the heel, the sacrum, the shoulders, and even the elbows here. So after that, we'll be moving on to the last portion, which is the safety portion. So I want to make sure that the patient is comfortable, and also to see if the patient is at fall risk through their charts or their ID bands. You want to have both top railings up and the bed at the lowest position. And lastly, you want to check their ID bands and verify for their name and date of birth. And that's it. That's the head to toe assessment.